So you guys all believe that the gut plays a role in autoimmune diseases, right? Yes? Okay. What else do you think plays a role in autoimmune besides gut dysfunction? Just blurt out the answers. What else do you feel? Besides gut, what else could cause autoimmunity? Your genetics. Okay, so one is genes could cause it. So condition, okay, which condition can you remember which is caused by genetic dysfunction? Occurs in 95% of men. It's usually a male predominant condition. Autoimmune. Affects the neck and the spine. Anyone? Yes, ankylosing. So that's a genetic condition. In that, 95% of people who have that polymorphism will have ankylosing spondylitis. So it's a very high predisposition. But in not all autoimmune, you will find this strong predisposition. For example, if you have Hashimoto's, in Hashimoto's the genetic component is hardly 2-3%. So some diseases are more genetically predisposed. For example, even atopic eczema, it could run in families. That's not autoimmune, but it can run in families. So what we usually do when we see a patient with an autoimmune disease is the first question we ask them, do you have this as a family history? The reason why we ask this is because we want to know how easy it is to treat it. If the patient has a family history, we know it's going to be more difficult and more complicated. And there is a homeopathic for this. It's called as carcinosin. C-A-R-C-I-S-I or carcinosin. So let me write that down. Carcinosin. So this is basically made from cancerous tissue and it controls the expression of P53. So I can give you an example. We had a case of eczema who would come to see me. She had a family history of eczema. Everybody in the family had it. And when I saw her, I couldn't notice anything spectacularly which was really in my face that I could prescribe anything else. So we just gave her a dose of carcinosin in front of me. And you won't believe, in less than 10 minutes, all the itching on her skin went off. Such chronic itching. So when you see any autoimmune disease with a family history, you just blindly prescribe it and it works really well. Including if the patient has a family history of cancer and they have any autoimmune disease, you just give them carcinosin. So this is the first thing, So if a patient has a family history, you could prescribe carcinosin. Then what else can you look at which could trigger autoimmune? Viral infections. You're looking at EBV, CMV. These viruses, they cause your immune system to alter its function, and they cause the immune system to start recognizing cells and target them. Because these viruses are present all throughout your cells. Like if you have a CMV infection and your IgG titer is very high, that could indicate that up to 70% to 80% of all your cells in your body are infected with it. And this IgG titer, if it's high and your IgM is normal, it doesn't mean that the virus is actually dormant. It just means that your body is producing enough of antibodies to sort of control its spread. But every time your immune system dips a little bit, the virus will again attack. So these viruses also need to be tackled. So in a lot of patients who have autoimmune, when we treat the EBV and CMV, they improve very nicely. So the second cause is viruses. Okay? So let's write that as genetic. Next is viral. Third one is environmental, or toxic metals. You must be experts by now in detoxification, right? Using DMSA, EDTA, glutathione, right? But how do you know that the patient has toxic metals in their body? Could anybody tell me how do you know they have it? So one is hair testing, but hair is only testing what? The presence of a toxic metal or the elimination of a metal? Elimination. And how soon would you come to know if that toxic metal is eliminated out? I mean, the hair profile is showing what is the time frame it's showing of the toxic metal existing in your body? Just a few months, right? Because your hair is going to fall off in a period of like a few months. So the hair profile testing is not really accurate because it's not showing accumulation of metals which is happening, it's just showing what your body is removing out. So it's not a very good test at all to use. What else could you use? You could do a urine challenge test, right? But again, if you do a urine challenge, first of all, you're basically pushing the patient into taking a large dose of DMSA or DMSO and trying to see what's coming out from his urine. But it's a difficult test to do, and also it's expensive to do it, and also could be risky for the patient's well-being. Then you have things like an oligoscan. If you have an oligoscan machine, one thing that you could do for fun is you can take the same patient, put his name and age as something else, and then scan him within a minute, of the time that you spend. So you scan him first, you change his name and age, and you scan him again. You will find that the test report is completely different. Have you played around with the machine like this? No? So if you do that, you'll find two different readings coming within a span of like 5 seconds also. So the machine is not very accurate at all. Okay? But still I have used it in a few patients and it has worked very well. So I can give you an example. This child was having sudden crying bouts. He would just start to cry for no rhyme or reason. He would just start to cry. And when you would catch him and hold him and ask him, oh, dude, why are you crying? He'd be like, I don't know, I'm just crying. So continuous crying, he was sent to the doctor and they told him that he's got some psychotic issues and he would have to be put on antidepressants. So he said, this is really weird. So I said, look, I don't know what's wrong with him, let's try an oligoscan. And we tried the oligoscan and we found a certain metal to be high in him that comes to batteries. So which metal do you think came through a battery? Cadmium. So he was very high in cadmium. Okay? And when we detoxified him for cadmium, his crying bouts all of a sudden stopped and he became completely normal. So how do we detoxify him through cadmium? We just used the homeopathic of cadmium on him, and hardly 3-4 days later he was perfectly normal. It's been more than 5 years now, he's perfectly normal. He goes to school, he comes first in his class. It was so bad that he couldn't even go to school. It was really, really bad. So sometimes the oligoscan, even though it's not accurate, it can be used. Then what else could be used? We can look at the patient's hemoglobin and check their vitamin B6 levels, zinc levels, magnesium levels. If these levels are usually low, the patient is usually trying to detoxify metals. So what I do is I look at the patient's protein levels in their CBC. Not in the CBC, in the normal blood test. If you find that their protein is low, it's usually because their stomach acid is not good. So your stomach acid forms with the stimulation of P5P, zinc and magnesium. And during detoxification of any metals, you're going to require all these 3 minerals. And when these minerals drop, not only do you get poor stomach acid and you get low protein, but you also get symptoms of those 3 things which are deficient in you. So low zinc will start causing white spots on the nails. The patients start having loss of taste in the mouth and they say, oh, I need more spice, I need more flavor in my food, I don't enjoy food without it. With their magnesium levels falling, they may get headaches, migraines, constipation. Okay? With their P5P falling, they may start having joint pains in their knees, start having excessive muscle cramps. So by just looking at these features in the beginning, I come to know, okay, this patient may be having some metal toxicity. It's a very simple thing you can do. In the patient's blood test, look at the protein levels. You guys have seen patients like this with low protein? You can put your hand up if you've seen a patient with low protein. Yeah, so you have seen this. And have you noticed the people who put their hands up that the patient usually has some acid problems, some sort of digestive issues? Yeah? So this is a very easy way to tell that the patient, first of all, has a metal toxicity problem. Secondly, now you have to identify which is the toxic metal the patient has. Even if you do a hair profiling testing, you may see the patient has aluminum poisoning, mercury, cadmium, lead, so many things will be there. So how do you know which one of those things is actually causing the symptom to that patient? Is there any way you guys can tell which particular metal is causing the symptom? Can you? Do you have any method that you can think of by which you could tell? No, right? There's no particular method that you were taught. That how do you tell which is what? Oh, the screen went off, I think. So, what you do for these cases, you basically start asking questions to the patient. For example, if you have aluminum poisoning, the usual symptoms that the patient has is really severe hair fall. They'll come with severe hair fall. They'll come with severe bloating of the stomach, like SIBO, and they'll start losing weight. If you've seen aluminum is used in these deodorants, it causes you to not perspire. So patients with aluminum poisoning will tell you, hey, you know what, I don't perspire that easily. I'm not sweating. My hair has become dry and it's falling off. Okay, and that will cause, I think the battery is on. So it will start causing the patient SIBO, small intestinal bowel overgrowth, because aluminum causes the growth of toxic bacteria in your gut. So what we do for such cases is we give them EDTA, we give them oral EDTA, and with that we give them just homeopathic alumina. It's a homeopathy made from aluminum. And within like hardly 3-4 days you start finding that the patient's hair fall has become better, the bloating and gas has improved, and they're much better off. Aluminum also causes leaky gut and can lead to autoimmune diseases of all types. When aluminum increases in the body, it starts forming granulomas all over the body. So sometimes in the lungs, the patient will start having granulomas. Okay? If you see in patients who've taken the vaccine at times, which has aluminum as an adjuvant, so these are basically vector-based vaccines which have aluminum as an adjuvant. So in such patients, once the patient takes the vaccine, the patient will have continuous pain in that arm lasting days and days and days. At times the pain doesn't go also. This is because of the aluminum toxicity that has happened over there, and if you give the patient homeopathic alumina, the pain will just disappear. So that's aluminum. How about things like mercury? It is one of the most toxic metals that we have. It comes through the food that you eat because you're eating fish. At least in your country, you're having a lot of fish diet. It's coming through your fish, it's coming through your beauty creams. If you don't know that, all the skin creams which are promoting fairness have mercury added to it because it lightens the skin. So you could have severe poisoning just by applying a beauty cream on your face. Not mine, it doesn't have mercury, but mostly all the creams which are having hydroquinone and all, they will add a little bit of mercury inside to do that. You can get it from fish, as I said, you can get it from those mercury fillings. Now I'll do a small little bit on the mercury fillings. There's a whole talk of biological dentists required to remove the filling. You don't need a biological dentist to take that filling out, okay? So don't be afraid of it. You can just go to a regular dentist. They'll put a thing called as a rubber dam in your mouth, which is just basically a piece of rubber that isolates your mouth. And then they'll just take a burr called a carbide burr. They'll just dip it into your tooth and the filling will just fly off. It takes less than a minute to take that filling off. And you can replace it with a simple cheap material like resin modified GIC. You can probably do like 8 fillings in your mouth in like 10 minutes with it. It will cost you nothing. So don't believe the hype about that. What does mercury do inside the system? It does a lot of things. So about 100 years ago, mercury was used in the treatment of a particular disease. Can anybody remember what disease it was used to cure? Who could tell me? Which was the disease that the doctors used mercury for as a cure? Who could tell me? Huh? Syphilis, exactly. It was called the greatest scam in medical history. The second greatest scam in medical history is the use of ivermectin for COVID, but the first was mercury. So, how did mercury work to cure syphilis? Very simple. So, in syphilis, there was a chancre which developed, right? And after a week, the chancre just disappeared. And some doctor realized that if I give mercury, the patient has excessive sweating, has excessive mouth salivation, and excessive urination and diarrhea. So he said, oh, because of the excessive urination, the infection must be passing out, and that is why mercury is working. So all the doctors all of a sudden started to use mercury in the treatment of syphilis. The chancre would go away, then the patient would end up getting latent syphilis. There were no symptoms except for weight loss, low-grade fever, some lymph nodes becoming palpable, some ulcers. They said, well, the patient is actually back to their normal self and they're doing quite well with my mercury. So 100 years was spent by doctors trying to optimize the dosing of mercury. Some will say, well, this dose is good. Some will say, oh, let's go higher in the dosing. Maybe higher doses are required. Finally, all the patients ended up dying of mercury toxicity. So what were the symptoms of mercury toxicity? Yeah? The first thing is that mercury lowers your body temperature. So these patients with mercury toxicity would never feel comfortable in a room. If you have this experience where you feel, oh, it's too cold now, I have to switch off the AC. After some time you say, oh, it's too hot now, I need to put the AC off. If you know a person who's like that, that's one of the very strong symptoms of mercury poisoning. Next is the patient can have tremors, intentional tremors. The number one cause of an intentional tremor is mercury toxicity. Patient will start becoming emaciated. Their blood pressures will shoot up. We did a case with Dr. Julie, I don't know if you are here. Oh, there's Dr. Juliana. So her maid's case, her maid was having a uterine cyst, right? Yeah. Very large cyst, and her BP was about 170 by I think 100 or so. So usually for an ovarian cyst, that's a hyperestrogenic state, and we have a medication called an estrogen inhibitor. So we give that with one other drug called Cardes, which is milthisil, which helps to remove the excess estrogen out from the liver. So I said, okay, let's do that. They said, what explains the high mercury? What explains the high BP? So it occurred to me that in the rat trials that we used to do, the blood pressure of the rat would shoot up. So we gave her Merck salt, and within a day the BP dropped to normal and all her pelvic pain disappeared, and that was just because of the effect of the Merck salt. Sorry. So I have been using Merck salt in a lot of patients with chronic hypertension, chronic diabetes, where the blood sugar and the BP just don't drop, and it brings both of them down. Even in patients who have autoimmune diseases, Hashimoto's especially, because the mercury bioaccumulates in the thyroid gland, it accumulates in the ovaries, it accumulates in the brain. We use Merck salt in the treatment of many autoimmune diseases. We're just looking for those symptoms. And if the patient tells us, that they're thermally sensitive, we say, oh, that's mercury and we need to give it. There are two types of patients who respond to mercury. One are mercury sensitive patients who will develop very high IgE and allergies. Okay, they become allergy prone. And the other type of patients who are not mercury sensitive, that means the HLA on their body doesn't recognize mercury that easily, they end up having autoimmune diseases. And some patients will continuously flip. So you may see patients who have autoimmune disease like psoriatic arthritis or psoriasis or whatever with high IgEs. And you're like, how is this patient having an allergic disorder along with an autoimmune? That's because of mercury. Okay? So we use the homeopathic Merck salt to remove the mercury out from those bioaccumulated sites. Even if you use DMSA and EDT and do whatever you want, that thing is not going to come out once it's bioaccumulated. But that Merck salt plucks it out from the system. You could also have lead toxicity. Yeah? Lead could be high in the person's body. Does anybody know of a symptom of lead toxicity they have seen? Yeah? Pardon? Blindness? Dizziness? Vision? You can give a microphone blurry vision. Lead could cause blurry vision, but there's something else that it causes. It causes severe constipation, very severe constipation. It's the most severest constipation. So you've seen Parkinson's patients, how bad the constipation is, very severe. So lead can cause you severe constipation as a side effect. It basically causes the same lead pipe sensation that mercury causes. The patient's legs will become stiff all of a sudden, stiffness in the legs when they are trying to walk. That's your lead poisoning. Then you can have cadmium, which affects your kidney. So you start seeing patients with kidney dysfunction, no no rhyme or reason. The patient say, oh, I was a smoker before. I didn't have such high blood pressure, but look, now my creat is going up. Okay, that's your cadmium. It bioaccumulates inside your kidney. So, toxic metals are another important cause of autoimmune diseases. And now last comes the gut. So how is the gut causing? So you've heard people talking about prebiotics, right? It's great to give them prebiotics. Probiotics are actually contraindicated in patients with autoimmune diseases because they could actually make it worse. For example, in autoimmune, your body has now lost the ability to recognize the difference between self and non-self. So if you give a probiotic to that patient, anyway the person's immune system cannot recognize the difference between self and non-self. Won't the probiotic aggravate? It actually does. In a lot of patients, it aggravates them. So hence prebiotics are good. Prebiotics are meant to increase the ability of the body to create food for good bacteria. And that's why they could be useful. But probiotics are definitely not. You can use postbiotics. So what we do in our medications is we are using a lot of postbiotics, one of which is acarbenzia. But what else do we do for leaky gut? And that's what I'm going to try to teach. Sorry, my laptop is going off. So leaky gut is measured how? Can anybody tell me how you would measure leaky gut? Or if not measure, how would you ask a patient if they have leaky gut? Anyone? How will you determine your patient has